center affiliated with Northside Hospital. How are you today, Dr.
I'm good. He's got PD.
What's he got?
Position dysfunction.
He's got position dysfunction.
Yeah, on a truck instead of electile dysfunction.
That's what they have in Florida.
I thought electile dysfunction, that was great. I mean, we're going to have to, you got to go electile dysfunction, hashtag electile dysfunction. You get to be famous in half an hour.
Wow.
Hashtag, or I don't know what hashtags mean.
Now, somebody's out there stealing my hashtag just as we speak.
Okay.
But no, that's great, right? I don't know. We can.
You'll wait Ray Tidman to be here. He'd make it even better out of it. He'd have some great joke for you. But
Would he have some good?
I can't help you. I'm not the joke guy. If I bring one, I get it from him the night before. Anyway,
so before we open, anything going on? How are things going? Nice and cold this morning?
Yeah, it's great. It's absolutely gorgeous. Last night when I walked out of the office, it was snowing. It was 31 degrees on the top of the hill right here behind us, and it was blinking snowing. Anyway, temperature was 33.
Well, you know, I enjoy this, and I listen to everybody. I'm watching social media, and everybody is talking about the 3 snowflakes that are out there, and everybody's all excited about it. But
well, they got a lot of snowflakes up in the Midwest. I mean, they're a terrible storm. Man.
This morning, where I grew up, this morning I would be knocking on your door at 8 years old, believe it or not, with my snow shovel, saying, "Can I shovel your driveway or your walk?" We used to make pretty.
Hey, I used to cut grass 25 cents a lawn. I was 8.5 years old. That was back when men were men, man. We walked uphill to and from school, right? 2 miles uphill both ways.
We didn't have a snowblower. There was 4 of us kids, and we went door to door, and we all had our snow shovels, and we got $5. But we had to do the walk all the way to the driveway. We had to do the driveway. It was big. So
you're a lot younger than I was.
We had to split it up.
It was a quarter yard when I was a kid. That was 1948. You're talking about 1968 or something. So anyway, go ahead.
Okay.
All right.
We need to move along.
The first question here. I'm going to do this because
you get me. You know, you make me a little older every week.
I do.
And you do that.
All right. I'm going to do. All right. I'm going to do the first question because it's a tongue twister. I was really recently diagnosed with primary biliary cirrhosis of my liver. Can primary biliary cirrhosis increase the risk of getting liver cancer?
Well, for sure you're going to tell us, but I want to know what biliary cirrhosis is, and what is that?
All right. Well, we're getting ready to show a great big old chart here. Well, first of all, it tells me that this first of all, this patient's probably in real good health. Second, that they haven't seen the specialist yet because the diagnosis of primary biliary cirrhosis is no longer called that. It's called primary biliary cholangitis, simply to better characterize the etiology causing cirrhosis. So the key word here is cirrhosis. Now, I'm not going to try and gag in. I noticed that you got some. Did you borrow those glasses, or
no?
You had new ones made.
I got
new ones made. Is that what that is? Okay. This chart that he's putting up here, if you look at it, that's kind of a lengthy chart. I don't expect anybody there to be able to read it. But this is the chart's titled "Common Causes of Abnormal Liver Blood Tests." The first step in developing cirrhosis is the doctor telling you, oh, on your lab test, you've got an abnormal liver function test. And this starts in order of magnitude. So the question is about cirrhosis, biliary cirrhosis.
Right.
But it's really, that's just what caused the cirrhosis, okay? So if you can read without your glasses, it's crystal clear what first cause of cirrhosis of the liver is
alcoholic liver disease.
Yeah, right. Alcohol is the first one. And then if you watch TV and see the ads all the time about going and getting your blood test, the second one is chronic hepatitis C. Okay, so common things are common, right? If you hear hoofbeats, it's probably horses and not zebras. All right. Well, the third one is primary biliary cholangitis, or this primary biliary cirrhosis. And then I won't run through all the rest of them, but after that, they become much less common and mostly autoimmune diseases. So biliary cholangitis is an autoimmune damage of the liver, not a virus like hepatitis C, not a toxin like if this was an alcohol and not a tab. So it is simply a mechanism for the development of cirrhosis. That's the first order. That's the first thing to know. Second, it's got a whole bunch of stages. Since the development of the new medications, the people that have stage 1 and stage 2 primary biliary cholangitis or cirrhosis have a normal lifespan and a normal life if they take their medicines. Like that guy with the diabetes who says, oh, my blood sugar was normal, I went back to the doctor, so I'm not taking my pills. Or my blood pressure was normal when I went to the doctor, so I'm not taking my blood pressure medicines. I keep telling people, don't stop a medicine. If your blood pressure is normal on blood pressure medicine, just stay on the medicine. Okay. So next thing to answer the question, the advanced stages do not turn into cancer, but can be treated by liver transplantation if it gets out of hand. So let's go to that next picture there of the elbow. You got the elbow there? Now if you look at this elbow, that's an ugly looking elbow. And that big old hunk of stuff hanging off the end of that elbow there, that looks like a callus or some response to an injury, doesn't it? That is a bunch of cholesterol that's made into a stone in your elbow. So that is one of the complications of primary biliary cholangitis. Let's go to that next picture of the face. Now, you will see, this is not uncommon. You've got some old grandmothers from when you were a kid that had these yellow plaques above the eye.
Yes.
All right, so that yellow plaque above the eye in your old grandmother was an aging phenomenon or a cholesterol plaque. So if a patient goes to see Dr. Tidman with some of this stuff on their elbow or some of this stuff on their eye, then Dr. Tidman's going to do liver function tests and cholesterol tests, and the cholesterol level is going to be really, really high in this patient and that patient. And those are some of the common complications of primary biliary cholangitis. So now you'll put this chart up next there if you don't mind, Josh. And so the first one that's associated with this, it's a complication you have to treat, is people itch like crazy because that cholesterol gets deposited in the skin. You got that? Mm-hmm. Plaques in the elbow, plaques in the face, plaques anywhere, but the two common ones are there in the elbow and in the face. Second is that this thing interferes with your bone metabolism, and men or even young people can get osteoporosis like postmenopausal women and have bone fractures because of the metabolic disorder caused by this amount of liver disease. The third one is these xanthomas, the name of that thing on your eye and your elbow, and the cholesterol. And then the rest of them all have to do with your inability to absorb vitamins or absorb nutrients out of your stomach. So lastly, we're going to go to our little chart. For the last 25 years, and I'm not going to even try and pronounce that word myself, okay? For the last 20 years, there is a drug that binds bile salts, that binds cholesterol, that diminishes the inflammatory reaction in the bile duct. Cholangitis, itis. Remember, dermatitis can be acne, it can be poison ivy, it can be anything. So itis just means inflammation. So biliary cholangitis is an inflamed bile duct. This material, if you take it, can make people with this diagnosis, abnormal liver functions, itch like crazy, plaques of cholesterol here and here, turn back to normal and have a normal lifespan and no cancer and no liver transplantation, okay? But they got to get the right diagnosis. It's usually made by a variety of blood tests and perhaps by a liver biopsy. You got to start out with one of your primary care docs who's doesn't just give you something for the itch, and the outlook is good. So our patient who asked the question probably has not yet seen a liver function specialist, because they still called it biliary cirrhosis and not cholangitis. They don't indicate that they're really sick as a dog, and it doesn't act like they're on the transplant list for a liver transplant. So I would say your outlook's good, you're not likely to have cancer, but it throws us back into the discussions here about all the other forms of cirrhosis, which is a weeks-long program with which we're not going to do. You got now? Is that enough?
Yeah.
You got a question about that?
No, I don't have a question. I actually understand what you were explaining, but the one takeaway that I don't want to gloss over is always use a rule of, if the doctor put you on the medication, let the doctor take you off the medication.
There you go.
Right?
You got it. Absolutely.
Okay.
And don't go in. I had a patient.
I'm going to try
that.
You know, say that out loud.
Yeah, say it out loud. I think we should say it out loud repeatedly. I've got a, you know, I'm a country guy. I've got a saying that is so true, and I hear it from everybody. If it ain't broke, don't fix it. So here you are. Yesterday, I think I've said once before that patients who have death, sudden death in the family, for example, you go home and you find your house burned down and your wife dead and your dog dead and everything else. I mean, that's a bad day.
Yeah,
right? That's a bad day. Well, there's been a placebo-controlled double-blind trial that says if that patient takes an antidepressant for 2 years, they overcome this grief better than if they take a purple pill. And in cancer patients who are undergoing treatment and who are having issues, if they take an antidepressant versus a purple pill, and then every day fill out a form about their quality of life, how much pain medicine did you take, did you go to the movies, their quality of life is better, the amount of pain medicine they take is less. And so now you fast forward 1.5 years or 2 years, the chemo is over with, or they pretty much gotten, you know, they kind of gotten behind the acute and chronic response to this house burning down and your wife being dead. And they are doing great. And they come in and say, I want you to take me off that antidepressant. Well, you would sort of think, that makes sense. It's 18 months later. If that situation, in that position where the drug's cheap and it's not causing you any side effects, the only thing that can happen when you take them off that drug, the only two things can happen when you take them off the drug. Nothing happens, or they get really depressed. Well, in which, if you leave them on the drug, only one thing can happen, and that is that they do good. So why would you want to stop the drug? Does that make sense?
Right.
People repeatedly say, I don't like the idea of taking medicine. Take me off. So certainly with primary biliary cirrhosis, if we take you off, you're going to end up down there trying to get yourself a liver transplant, or you're going to have that itch or that thing come back on you, so don't do it. But that concept that you just came to is your doctor put you on it, he should take you off of it. But there's one more thing. Don't go in there and tell the guy, I don't want to take any more pills. I'm doing great, so take me off my medicine. I mean, that's what I'm trying to get to. Got it?
Got it.
Makes sense.
Let's go to our second question, and we want to thank again Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Now, our second question. I believe my 4-year-old has some sort of food texture issue. He can be eating and then out of nowhere put a bite, same size, in his mouth, and he will gag and then puke in the plate. It isn't consistent as to what causes it. It isn't consistent as to what causes it each time it occurs. What can we do to get this to quit doing this? To get him to quit doing this?
I tell you, that's a really good question. It is if I'm not wrong, it's 5 to 18% of children will at some point have rumination syndrome. got that word here. Let me
Yeah,
rumination syndrome. Okay. You have established by the question that it's not an anatomical swallowing difficulty because it's intermittent. It's not an allergy because it's different things at different times, and it's inconsistent. The causes almost always psychiatric. Okay. Now, you're talking about a 4-year-old. How in the world is a 4-year-old, hey, Josh, how's a 4-year-old psychiatric? You got to look, is there something in the, we've got the idea here that this is recent in onset, hadn't been going on forever. The kid's not drastically losing weight. There's a bunch of parts here. If this is happening and the kid's losing weight instead of gaining, because children of 4 ought to be constantly growing and gaining weight. So I'm going to make the assumption that it's not sufficient for them to be losing weight. I'm going to make it that it's not sufficient enough to where they're having, dehydration problems. And so then it becomes, and the way the question's written, what can we do to make it happen, is the mother or whoever asked the question, the grandmother, realizes it's behavioral. Because they're asking you, what can you do to make it stop? It's not like it's, how do we choose what food it was for an allergy, or how do we learn about swallowing for somebody who's had a stroke or something? So this is a behavioral thing, this rumination syndrome. You've got to look, and it's generally emotional. So if you got a 4-year-old, is there stress in the home? You're undergoing a divorce. Are they people fighting about money, or something of that sort? And generally this disappears, and that's why you don't see so many of them in the doctor's office. It disappears because the stress gets managed. Somebody figures out, grandmother, somebody else, that the kid's being bullied in kindergarten or something. So you look at behaviors. This is a behavior. It's not anatomic. It's not allergic. By the way the question's asked, it's behavioral. So you got to figure out what's going on in that kid's life that's behavioral that you might be able to impact. And being bullied in school might be one. Being bullied by brothers or siblings might be another. Stress, their mom and dad are fighting all the time, or dad just left the house or whatever. So getting the kid's life back together again may fix the problem. Now, if it lasts, how long does it have to last here? If it lasts longer than 2 months and isn't fixed by those manipulations, then you take them to the doctor and they end up in child psychology, or maybe the pediatrician. And by the way, this is the one place where they say take them to a pediatrician. And Ray Tidman's not a pediatrician. He's a real good doc, but this is a specific thing that pediatricians have been taught to deal with. And they will deal with it through a period. 2 months is when you need to take them to the doctor. And then the pediatrician, I think, is going to deal with it till it's 6 months, and at 6 months is going to go to child psychiatrist. So this is not a joke.
Well, no, I mean, I understand that. And in fact, I like the range and the different direction of the questions we do get here on Friday. We do get an opportunity to talk about a lot of different stuff. And that there's no question that's, some people might think, well, I don't know if that's a serious question. When they're writing it, send it in, because I understand what you're saying there. Again, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Dr. Whaley, what do we have?
And that wasn't even a cancer question. That was a non-cancer question, and it was really a good one, I thought.
Yes, but now I know what
rumination syndrome.
Yeah, rumination syndrome and biliary
cholangitis.
All right. So, what is new today out there? What have you been researching?
I'm going to let you pick it. First of all,
okay.
All right. Well, first of all, I got something I got to say. I've been beating on you about mosquitoes and beating on you about ticks. So, what's that say? Read the headline.
Tick-borne diseases set U.S. record in 2017.
Last year, I told you, 2018 now.
The ticks.
You're paying your 2017 taxes about now, right? October, November. All
That's
right,
why that's why I don't run my possum off.
yeah. So the medicines analysis is coming up now. Since we've been doing this program, we've been doing this program what, 5 years or something like that?
And we've been doing it a while.
Okay,
Yes, sir.
all right. 9 new tick-borne diseases have been found in that period of time. And the number, like last year I said 86,000 people died of the flu. The average is 30,000. Go get your flu shots. That's the same kind of magnitude of tick disease increase that has occurred in 2017 compared to 2014. So, and this is Tickville up here in the mountains. Now that's getting cold, so ticks will be gone for a while. But I keep saying that this is not a joke. The tick.
I'm sorry.
He
said
Tickville,
yeah.
Tickville, yeah.
He liked
oh,
that.
Hickville, you're thinking. Tickville, okay. You got to. People got to be serious about their tick protection, and it's real. So that's all we're going to say about that. But that came out yesterday.
But we're not. I'm going to say something about it.
Was yesterday the 15th of November?
Yes.
Okay. November the 15th. So that's hot off the press.
Now, okay, so the other day, I get a message. Possums eat ticks.
Yes,
They do.
I know that.
And so
I almost ran over one last night, and I stopped and let him cross the road.
yeah, possums eat ticks. And I go outside, and I say, Lisa, what are you doing? She said, I'm feeding my possum. She said, I keep my possum fed. I said, okay, which I have seen. Yeah, I've seen the possum, all right. She said, no, I don't let my possum leave. She said, you ever see a tick on our dogs?
And so she knew that before you did?
Yeah.
She's into that natural stuff.
Yeah, she keeps her possum taken care of.
She probably uses
I had to bring that up.
She used that red pepper stuff to keep the bugs off her tomatoes instead of tomatoes.
What is that over there? Oh, that's to feed my possum. All right, anyhow.
All right, go ahead.
So I had to bring that up.
Okay, now I think we brought this. I think we were.
This one I'm very interested
all right,
in.
I think we were the.
Yes.
Like we were the first ones on Zika by about a year, weren't we?
FDA to limit flavored e-cigarettes and ban menthol.
Okay, now this is a racial thing, and it is going to hit the news, and everybody's going to go to the racial piece of it.
Yes.
What's the racial piece of it?
Menthol.
Menthol. 1/3 of the tobacco products sold in the United States are menthol. 1/3. Now that's a big number. When Walmart profits go down, or they miss by 0.5% their target on profit, stock falls. 1/3 of what these tobacco companies sell is mentholated cigarettes. The market for mentholated cigarettes tends to be more minority than it does Anglo-Saxon. So the focus that everybody's made since this came out yesterday morning is on that part of it, whereas the real intent is to try and get your arms around the e-cigarette, which we've been talking about here for a while. So I don't know, the Juul Company came out, this was yesterday, the Juul Company came out on the 13th, 2 days before, which I guess was Monday, Tuesday, and they said all of those 70 flavors that I mentioned when I was on here once before are going to be removed from the market. What they're going to leave out there is unflavored nicotine, which is going to make, it's not going to make a whole lot of difference, except that the 12 and 14-year-old is doing it because of the vanilla flavor or the strawberry flavor or something, isn't going to have a chance. So that was what Juul did. I'm going to take these flavored ones off the market. What the government did was, you're going to have a gate, big old clangy gate, an area in the 7-Eleven where you've got to go into it as an adult, and it's got to be closed off. It's not going to be just a rack above the back of the store. Now, I don't know if you've been to a cigar store in Europe or in an international duty-free shop, in an international duty-free shops, the humidor, rather than being like that fireplace over there where you go and get drawers, is shut off with a big, huge door, and you've got to get somebody to buzz you in like going into a bank or something. I don't really think that's as much as they should have done, but that's a good first step, and I hope that problem goes away.
They're going to remove the flavored cigars, like the like those packs of like flavored cigars and stuff like that. They're going to remove all of those.
Yeah, all of those. Yeah, I didn't mean to just stick on menthol, but that whole market is primarily minorities. And so they're going to come up with that being the second page.
FDA to limit flavored cigarettes, ban menthol. Yeah. E-cigarettes, flavored e-cigarettes, and ban menthol. The U.S. Drug Administration said Thursday it will take steps to limit or ban access to flavored e-cigarettes, menthol cigarettes, and flavored cigarettes. Yeah. And the thing is, whether you say they're racial or not, it's fact. You drive into a city, and as soon as you get in the city, you know, you get out and you see the billboard for schools, and you see the billboard for Newports, whether you admit to it or not. You know,
true. Yeah.
You know, so the menthol
down around the stadium.
They market to.
You don't see those on West Patience Ferry Road.
No, they market to minorities, and so I'm there's some things here that the freedom of choice to make your decision to do, and the government, there's always those kind of things where I just want to be a little I like to take a little time to think about this one. I like the moves, you know what I'm saying? When you first read it, you like the moves, you just want to see, hey,
I want to see anything that keeps kids off this stuff.
I'll agree with that 100%.
And the thing about the seatbelt, the seatbelt, the motorcycle helmet, and all of that, that's another whole argument. I got one more thing because I think it's very important this week. I want you to assume that the turkey that you buy, by the way, the cost of a holiday meal is the lowest this year as it has been in the last decade because of the oversupply of turkeys. Turkeys are selling for like 78 to 98 cents a pound.
Right.
So the turkey's going to cost less. Your turkey is contaminated with salmonella. Make that assumption when you open up that turkey. Now, how does that alter your behavior when you cook the turkey? One, don't wash the turkey. But you do what you're supposed to do all the time, and that is when you cut up the turkey on a cutting board, the cutting board then goes back in the sink and gets totally washed. The hands get totally washed. The knife you cut it with, you don't go over and start cutting up the salad with, or you're going to get salmonella in your salad. And you just think there's salmonella on that turkey, and then you stick that thing in there and you make sure that turkey's 165 degrees before you take it out. You're going to have a real nice Thanksgiving dinner. But the amount of salmonella contamination of poultry is at such a high level that it cannot be, for the way we slaughter them and the way we send them, it cannot be eliminated. Therefore, buyer beware and be safe. And that's just one. I mean, I've always said that about chopping up a chicken and frying chicken. So just believe that your turkey is contaminated with salmonella and treat it that way and have a really good turkey.
There you go. That's good information. Don't forget, folks, if you have a question for Dr. Whaley, you can email it to info@vetyournews.com. Put in the subject area, ask the doc, and send us your question for Dr. Whaley, and we'll get an answer for you. We always send everyone to Dr. Whaley, no matter how many we get, and so send those to us. Again, info@vetyournews.com. And again, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. We're going to take a brief break.
And we won't be here next Friday.
We won't be here next Friday.
No.
That's why
I'm going to be with my
I'm wearing my
grandkids next
sweater
Friday.
today because next Friday, the day after Thanksgiving, I can't kick off the Christmas. I've already been told I was too early, but I had
You're
to
not
do
too
it.
early.
Okay, so that's why I had to wear the sweater today. Okay, and I think as crazy as Florida is, I'm ready to celebrate Festivus any minute. Okay? The election. Let's take a break. We'll be right back with the All-Star Political Panel.